Hi, my name's Kim. I'm a licensed and nationally certified Chinese medical provider, and today I'm going to talk about blood stasis and how acupuncture can help you deal with chronic pain. So blood stasis is a common term slung about in acupuncture circles, and you might even have heard from your acupuncturist that you have blood stasis. Let me tell you a little bit about how you can identify blood stasis in yourself, and then some of the common causes of blood stasis, and after that, let's look at some of the treatment strategies. Let's start with how you know if you have blood stasis. What's the most common symptom that you would have if you had blood stasis? Pain. P-A-I-N, pain. Pain is going to be the most common symptom that you'll have if you have blood stasis, and severe blood stasis means severe pain. And a little bit of blood stasis might be like stiffness. Severe blood stasis can cause neuropathy, so where you can't feel your fingers or your toes. And blood stasis can cause swelling. So a great example of that would be bruising, right? So bruising is blood stasis, but also swelling in your ankles or your feet, in your hands, that can also be blood stasis. What about the prevalence? How common is chronic pain? Because that's what we're talking about, right? Is chronic pain? Well, globally. So across the whole world, right now they think it's about 20% of the whole population. So we've got 7 billion people on this planet. 20% of them report chronic pain. Here in the United States, that statistic for our population is a little bit bigger than that. And then let's look at those adults over 76 years old. The CDC did a study on that. Guess what? Over 76 and 76% of them reported chronic pain. So from 20 to 76%, that's a big jump. What about the difference between men and women? The studies from the National Institute of Health think that women have more chronic pain than men, and fibromyalgia is a great example of that, because in fibromyalgia, for every 9 women who report symptoms of fibromyalgia, there will be 1 man. So 9 to 1, big difference there. There was another study done in 2019 by the CDC on income levels, and what they found is that lower income has a 25% increase reporting in chronic pain than those that are making more than the average salary nationwide. Amazing, huh? So, I guess what I'm saying is that chronic pain, it's common. It's really common. And as you get older, it apparently gets worse. So where you're at right now is going to be like the best time for you to start putting in a plan to start managing your pain so that it's reduced by the time you get to the 76, because you don't want to be the 76, right? You don't want to be the 76-year-old person and one of the 76% that's reporting pain. You want to be the 76-24. So to get there, you're going to want to start managing that as pain as soon as possible. Okay. So the root cause of pain in Chinese medicine is going to be blood stasis. So what is blood stasis and what causes it? In Chinese medicine, blood stasis is going to be when the blood is not flowing the way it should. So for some reason, either the blood's slowing down, or it's blocked and it can't get there, or it's just not flowing in certain areas. Okay, so then what's going to be the leading causes of blood stasis in the body? Well, it's going to be things like, this one you probably would guess: injury, emotional stress, trauma, diet and lifestyles. So injury, emotional stress, trauma, diet and lifestyle, Georgie. Injuries are the easiest to understand because Car accidents and sports injuries usually have long-term consequences, but it takes a long time for you to actually see them impact your daily life. So let's look at car accidents. Car accidents cause trauma to your body, and this trauma, for a split second, changes the alignment of your bones. And the most common injuries that you're going to get in car accidents is whiplash and lower back trauma. So that split second of your head being thrown forward and back changes the alignment in your bones. Now that change in your bone alignment, that's going to cause a permanent shift in how your bones are lining up with each other. And that shift over time is going to have those bones rubbing against each other in a different way and causing small trauma to the ends of the bones. And how do the bones respond to trauma? Well, they grow. And if we look at bone, it takes bones 7 years to completely reform. So if you looked at your body right now and you looked at all the bones in your body and you took a stake and you put it in the ground right now today, 7 years from today, the bones that you have in your body will have completely reformed. And after an injury, it takes 2 7-year cycles for the x-rays to actually show the damage, that your bones have reformed enough that you can actually see the damage now on x-rays. And then it takes 3 7-year cycles for you to actually have that damage start to impact your daily activities. So when you're looking at a car accident, the first 2 years are the best years ever. You probably won't even feel the extensive damage that has happened to your body because it takes your body so many years to reform. What about emotional stress and trauma? Emotional stress and trauma can cause blood stasis and that severe pain. So fibromyalgia is a perfect example. And from a Chinese medical perspective, one of the leading contributors to fibromyalgia is going to be emotional trauma. And it's going to be that long-term chronic emotional stress, and that can lead to blood stasis. So, you know what? If you want to learn more about how emotions can lead to some of these really chronic situations in the body, check out my videos on the acupuncture clock or any of the videos under my emotional healing section, because that goes into a lot of detail about how emotions will feed into your physical body and change how your physical body responds in the world. And then there's diet and lifestyle. And in order for your body to function optimally, it needs the appropriate nutrition. Yet today there's a problem in our commercially grown foods or commercially processed foods in getting enough of the nutrition that you need. So you might not have the nutrition you need to rebuild the body in the way that you need to. And then you can add in lifestyle decisions to that, and that can just make that problem worse. And so lifestyle, like the chronic stress, for some reason, it's really important in the United States to be under chronic stress, right? I mean, just the amount of pressure that we're feeling from jobs, from trying to just survive today. It's this chronic stress. There's a book that I really like by Hans Sell on the stress of life. And that might be a really good book. You might want to read that because that will give you some more ideas of how stress impacts your body physically. And it will show you how it actually uses too much of certain minerals and how just that lifestyle can deplete your body of key minerals that you need. And those minerals that you need, without them, you get to experience anxiety or explosive anger, just things that make your stress even worse. So what do I learn from acupuncture theory in treating chronic pain and blood stasis? Well, First off, don't ice. And you might be asking, why not ice? Well, we're talking about chronic pain, and that's something that's been around for a long time. It's not a new injury, and a new injury is about blood vessels that you just broke or tissues that have been torn. And what you want to do with a new injury is you want to reduce the amount of inflammation and swelling to reduce the amount of damage to the area, right? So icing is great within the first 30 minutes because that will help reduce the amount of inflammation that's going to happen to that injury. But we're talking about chronic pain. We're talking about something that's been around for a long time. That's not what chronic pain is about. Chronic pain is about changes that have happened in your body that have permanently changed the way your body functions. These changes have slowed the flow of blood or interstitial fluid to the area that's damaged. So when you add in ice and to an old injury that's been around for more than 38 minutes, what you're doing is you're encouraging the flow of interstitial fluids and the flow of blood, and blood is what brings the nutrients to the area to repair and maintain the damage. You're encouraging your body to stop doing that. No, don't need any new supplies here. We're fine the way we are. And by doing that, what you're actually encouraging to have happen is you're encouraging more damage to happen in the place. So, first, do not ice. So first off, don't ice. So let's just not ice, and instead, let's use heat, okay? What else can we do? How about, okay, here's another thought. What about incorporating essential oils? Essential oils are easy for you to access. There is a lot of distributors who are selling essential oils, and essential oils are herbs. A big part of Chinese medicine is herbs. And so let me tell you about some of the herbs that you can use, or some of the essential oils that you can use that you're going to have easy access to, and you can use them and apply them to wherever you have pain. And the first one is going to be frankincense. That is one of the premier blood-moving herbs in Chinese medicine. So whatever you're using, use frankincense. And then what you can add to this, and especially if you have like the fibromyalgia pain, which is about the emotional trauma and stress, add in the wood essential oils. And one that I would choose is sandalwood, because that's such a great chi mover. And it's also really good for the emotions. So frankincense, sandalwood. And you know, what you can do with those is you can apply them, you can mix them together and apply them directly to wherever you have pain, or you can put them in your body lotion and, you know, use that to help with your pain. Here's the thing that I've noticed in clinic, okay? I have noticed a difference between medical grade herbs and the herbs that you can get from the distributors. So I do use essential oils from distributors, but I can tell you when I'm doing some of the emotional healing work, some of my own personal pain and trauma work, and some of the transcendence work that I do with clients, I use medical grade herbs because I've just noticed personally there's a big difference between the two. So it's not that the distributor ones don't work, it's just that the medical grade ones work so much better. You know what, I have an article on my website. I was writing about the barking cough, because you know that's become so common today with the changes in our flus and colds and stuff like that. So I did an article on how you can treat that naturally with herbs. And I went into an explanation of what is the difference between medical grade herbs and just the herbs that we can get from distributors here in the United States that fall under FDA guidelines. So there should be a link up here someplace to get you to that. But if there isn't, guess what? Somewhere, wherever they have the description, that link will be in there. The last thing that I'd recommend is starting a management plan. That comes from experience. If I would have known that some of the sports injuries that I had suffered were going to get worse over time, if someone would have told me that, I would have started managing and handling my pain differently earlier on. But I'm here now, and so I'm just going to share with you my experience. Start your management plan early on. And in that management plan, I would always do acupuncture, whether it's once a month, whatever it is, but have a maintenance plan with acupuncture, because that is the only medicine that is going to get those tissues flowing again. And that is the only medicine that has also been identified by the World Health Organization as a medicine that actually heals people. So acupuncture, definitely make that part of your plan. And then start practicing some Tai Chi and yoga. I can't tell you how amazingly effective those two things are at helping you maintain your body's mobility and keeping your pain at a low scale. Okay, so there are some ideas on how you can manage blood stasis. And thanks for coming out. Until next time, I'll catch you on the other side.